Ted, similarly to what Tom was speaking on, what clarifications from the CDC could have helped, or how would you like to react to anything that happened during the Romaine?
Well, I think, Tom spoke, in detail about, what would, I don't know, is the mic working? Yeah. Guys can hear me? Yeah. Yeah, he spoke in detail about the need for specific, areas of growth or grower shippers, so we could do a true recall. I mean, a true recall is something that we know how to handle. We've gone through in the past. We practice. We do mock recalls. We do live recalls, and we know how to manage a recall, but we don't know how to manage a market withdrawal. And so that just left a big question in everyone's mind of what do we do? We had a lot of product in-house. We had product rolling. It's like, do we dump it today? Do we dump it next week? Do we hold it? Everyone is looking to us for answers, and those are answers that we did not have. Another question that we have is commodity romaine was identified, and all the PR was on commodity romaine, but a big element of our recall were mixed baby greens, and were baby lettuces considered and treated at the same level as whole head romaine. And we don't know how, it's not in the ground as long. We think it's maybe not as risky or susceptible, and was that considered when the CDC did this market withdrawal?
So that's a lot to respond to. I think the big picture response is that, and I'm not saying this callously, I think it's a problem. The big picture comment is that, again, CDC historically, and still through organizational habit, thinks as its target audience as being the public. So they're not necessarily, probably should, but we're not necessarily thinking of industry. And even if we were, as I told you, we don't know probably enough to say something useful. But this is an example of how I think we need to, especially now in this day and age of whole genome sequencing, we need to be figuring out as many ways for us to start informing each other. Because I think we're seeing some very faint signals that are leading us, because of the technology, to some conclusions that we think we need to respond to, and therefore the public. I think we need, in order to craft those messages, that decision, that messaging has to be as informed as possible, and probably from your side. So, sorry for going on, but to me, I've been thinking that maybe in some of the, depending on the nature of these clusters or outbreaks, the first audience shouldn't be the public, it should be you guys. Because maybe you can help us interpret some of these faint signals better.
Absolutely.
I have a question. If the timing was different, if this was 2 months earlier and we weren't leading into Thanksgiving, would CDC have pulled the trigger on the withdrawal advisory?
So the quick answer is a definite maybe. So this is just to show you how fast things are moving. Up until about 6 months ago, if you ask CDC, when do you communicate, they would say, we're only going to communicate when we know that it's Colonel Mustard in the conservatory with a candlestick. Okay, well then what have we seen this year? We've seen the Romaine events. We've seen the poultry people are not very happy because we've had some raw chicken and raw turkey events. And all three of those, and maybe others that I'm not aware of, are examples of the exact opposite, where we're seeing a broad signal. And the only thing I can think of as being different is that the technology is giving us more confidence in the faint signal. And then there's a sense that, okay, we know this, the public needs to know it. I think this takes a whole lot more discussion, and probably in a setting like this after the crisis, when nobody's, quite as defensive and in survival mode as you are when in the middle of a crisis.
Anyone want to comment? Go ahead.
No, I guess your next question is how do we prepare? And, I think the only thing we can do to prepare is prepare our messaging in case this happens, how do we react? You know, like Billy was talking about, you know, he had very positive messaging and came out into the public and with a very, you know, proactive message to his customers and to the industry. You know, I think that's the only way you can prepare, you know, all of our preparations with our investment in the WMS and traceability and really knowing what case went to what customer, because we've invested heavily in that. But none of that came into play because there was no true recall that we couldn't, you know, no brand or lot was affected or identified. So all of our recall processes and practice were pretty much ineffective and not in play.
One of the ways you can prepare once we finalize this template from the FDA is program that into your system so that at a couple of keystrokes when you get the phone call, Romaine, Thursday, boom, here you go. Look at your email, but to their exact specifications of that template. There's going to be a very prescribed template that if you fill it out exactly as instructed, they're going to get off your back and you'll help the industry, help them find out the exact source of the or point of convergence.
But I think Ed and Ted's defense, what we never want to have happen again is a market withdrawal of an entire commodity. And so hopefully, you know, I agree, this was an unprecedented event for us. I mean, none of our members knew how to prepare for it. They knew how to prepare for a recall, absolutely. I mean, they worked with our team on that. But, you know, I think our goal is to never have a full market withdrawal of a commodity happen again because we know we have the ability with your networks. You keep track, great records of what you do. And, you know, I think we're able to work with the agencies and help you. We can look at data and help you now understand how things move through the supply chain so we never have to see something like this happen again.
Yeah, and without more communication, without improving so that we can avoid the market withdrawal, if it were to repeat itself, just speaking from a distributor standpoint, we've investigated what insurances would be, what we could do partnering with growers, shippers, with customers, and if there was another market withdrawal event identical to what happened last year, all the distributors in this room would suffer the same types of massive losses again. So we really need to work together proactively to help prevent that in the future, to prevent those financial losses throughout the whole industry.
Yeah.
And it's kind of like the priorities of the task force. One, prevention. Prevent the product from getting contaminated in the first place. That's what the water committee's working on, or water group. The second, the traceability group, prevent market withdrawals if we can give them and they, you know, information rapidly, accurately, and they can identify the point of contamination or convergence, then it won't be a market withdrawal. It'll be a recall, a specific recall. And, you know, so failing both of those, that's when you end up with a market withdrawal. So there are a couple of things we're working on, and hopefully the entire industry will embrace it, that we can avoid those ever again.
I'm going to turn to Barb. You've been reading many articles and involved in many discussions with others in the industry. What have you learned since the food safety withdrawal to help Produce Alliance and be better prepared for the future?
Hi. Well, as most of you know me from the Romaine, I'm still living Romaine, as we all know. With the past 2 or 3 events that we've had, from my seat, it's always been the information changes, and it changes very, very quickly. And being able to communicate to all of you, as well as our concepts, has always been a challenge. So just really keeping a very consistent message, but in keeping with whatever the CDC or the FDA says, so that we're not misrepresenting that. And then lessons learned from both of these has been really uncertainty really breeds anxiety with our distributors, with our concepts, with customers, and the types of phone calls that we get. And then for me, as a whole, I've really made an effort to stay connected with industry groups, FDA, CDC, and I think being on these task force and being, you know, kind of staying connected with education really helps me at least stay in, I wouldn't say in front, but along with everybody else and trying to figure out what's going to happen next. What are next viable solutions that would help the distributor in terms of technology, or what do I know? and then just imparting that information to you guys as well as our customers, because our customers really have the biggest questions and the angst. I don't want to buy Romaine. How long don't I buy Romaine for? What are good substitutes? All those types of things.
In our industry, we are all aware that protecting the health and safety for our customers and their patrons is of the utmost importance. While we do what we can to protect our businesses with insurance and from other forms, which Tom already alluded to, many people feel that due to the recent situations, businesses could become increasingly unstable if we're not able to have insurance to protect us in these types of situations. This instability can cause dramatic financial situations, resulting in long-term damage to our businesses. In a quick poll, can you please show who from this experience lost in the categories below? 0 to $50,000, 50 to $100,000, 100 to $250,000, and $250,000 plus. Just in the first. So, I mean, I comment on this all the time because I think that what we always try to do is just plan for sustainability and for the protection of business through insurance. And what Rob is going to speak on next is what we can do to try to have insurance so that we can do what we can to protect our business from doing the best we can for our customers and for our clients. And we had done our past, tried to protect ourselves in recalls and in recall insurance, but this unprecedented market withdrawal or market awareness, there was no type of insurance to protect us. So Rob, can you please go over your learnings of what you discovered on insurance for these situations? Please describe recall insurance and why the situation was different.
So as a result of this advisory, we began contacting many national insurance companies just to talk about this. And through our insurance company, one of the larger national insurance companies, we got the opportunity to speak with one of the senior executives at Chubb Insurance. Most of you know Chubb is a high-end homeowner and business insurance underwriter, but they're also one of the largest recall insurance underwriters. And as Tom mentioned, Ed mentioned, Chubb did not pay out on any of its policies as a result of this advisory. But they also understood that there was a detrimental effect in the entire chain of title with everybody in terms of losses on this. And what they are beginning to do, and they've asked our help, and I'm inviting anyone who wants to participate to talk to me either after the meeting or after the conference. They're forming a task force, and they're looking into broadening coverage to give some coverage for this type of situation where no product and no company is specifically named. And what they want to do is they were talking about a number of different endorsements, third-party financial loss endorsements to cover credits that customers take, adverse publicity endorsements, because as soon as this gets out and gets out on social media, you're destroyed already, whether you're going to have a loss, whether it turns out in the situation of the advisory, it came out on Friday, and I think Monday was a holiday. It was Wednesday. So you had, even if it turned around, the losses were already enormous. And then the other thing they were talking about is product refusal endorsement, to Ted's point, of all of the product that was on the road that got rejected. And so what they want to do is really put together, they understand how important this was, and they really want to put together a task force of larger insurance companies to try and find something that can fit into this specific situation. The issue, of course, is going to be premiums and deductibles and whether it becomes cost effective to do it. but at least they're recognizing the fact that so many people lost so much money here and there was really no insurance help, and they're taking steps. And I'm going to be involved in it with our insurance company and with Chubb and anybody else who is interested in being a part of it. Please let me know, and I'll be putting that together once we're back from the conference.
Awesome. This was also a question that was posed to us. Have any of your food service or retail customers written into their contracts protections for themselves, putting the cost burden onto the distributors for this type of event in the future? Yes or no? So many renewals have maybe not come out, but this is things that are being talked about in the future, that customers are saying, if this happens in the future, you need to be paying for any products that are lost. And we're seeing that within our national agreements, and we're hearing that distributors are seeing that in what they're doing, since we all saw that, trying to follow and saying that it was following the CDC's wording. Just an interesting, again, these polls are just to understand the pulse of what we're seeing within the industry. Ed, from your standpoint, could you give a brief viewpoint of how technology could protect, and we've kind of gone over a little bit with this new template, but in a food safety withdrawal, what other benefits would a WMS provide? I know there's a breakout session on this a little bit further out, but how could you see that this having other ROIs for distributors?
Yeah, frankly, if you're required to fill out this template and submit it within 2 hours of the phone call from your customer, I'm not sure how you could do it without a WMS. Most of you are tracking lot number in and lot number out. That's phenomenal. But I remember when I ran warehouses decades ago, without warehouse management systems, I'm not sure how I'd be able to have all that paperwork and be able to get it done within 2 hours. What we're seeing, or what I've seen, is there's starting to roll out that suppliers are communicating electronically with the advanced ship notification into their customers. And that's an electronic bill of lading, but it takes it down to the pallet level, and it has a barcode on each pallet called this SSCC 18, Serialized Shipment Container Code. It's a serial number for the pallet. And it has in the electronic message the GTIN and lot number and case quantity on the pallet. So if there's 48 cases of lettuce, it may say there's 40 cases of this GTIN and this lot number and 8 cases of this GTIN and lot number on this pallet ID number. And when the pallet gets received, you just scan, you bring that electronic message into your warehouse management system before the truck arrives. And when it does arrive, you scan the pallet license plate and you verify, yeah, 48, yeah, it looks good, receive it. You now have all that information captured. It's tied to that pallet position. I've seen some companies use that SSCC barcoded label as their license plate. They don't put on their own license plate for their internal warehouse management system. It's already got one. I'm going to use that, and they use that to track it all the way through. And you can gain pretty good efficiencies on your inbound. I remember when I ran grocery DCs, the toughest receiving job I had was fresh produce. These guys don't know a Macintosh from a Granny Smith, and when they're receiving at 4 o'clock on a Monday morning, they're not very good at knowing the product or product knowledge, and I tend to have mistakes on the fresh produce receiving. All the other stuff, cornflakes and diapers and all that, that was easy. There's usually a barcode on that case. So we're starting to see that roll out. Walmart's pushing it the most. Walmart's actually taking it to a whole nother level with this blockchain with IBM. And if you want to hear about that, come see me after. I'm actually an advisor to IBM on their food trust network, because they clearly don't understand the fresh produce industry, but they're learning with Walmart's help and mine. But yeah, and I understand 30% of the companies here do not have a WMS. I'm not sure. I'm biased because I implemented many warehouse management systems in many food service and retail warehouses. If you don't have one, you're going to be left behind. There are so many efficiencies to be gained by having a good system. Come watch us tomorrow. We've got a session on that, and you'll hear some real live examples of the different areas of efficiency you can gain through it. But the biggest and purely on traceability, and I'm biased on traceability because I've been working at PTI for the last 8 years I've been with PMA. In order to have that ability, one, to track your inbound G10 lot numbers at the case level and tracking it outbound, but being able to pull that information and send it off. If you have 2 hours, if you can do it in 2 minutes, FDA's now, that much further ahead in solving where the source of this problem is. Yeah. And that's the name of the game. That's why we're doing this traceability. That's why we want to bounce right from the retail source, either the restaurant or the store, right back to the brand owner, the person who packed the product. We're not going to worry about the middle of the supply chain. If we can bounce there on the investigation piece, so we can stop that product from continuing getting into the market, and so we can identify that is truly the source, and then we can shut it down, then we won't have any more category killer recalls.
Awesome. Anything else from the panel before I open up for a few questions? You okay with a few questions? Okay. Okay, as long as you guys are nice. Any few questions? Joe, Zeno, do you have a question?
He's always got questions.
So, yeah, I think I did say it earlier. Is it from, we're a bunch of doctors and microbiologists and public health people. It was tough enough for us to see the difference between various leafy greens, not to mention things that are meaningful to your business in terms of subcategories or Romaine. So I would say it was basically we didn't appreciate the need to kind of disaggregate that messaging. So.
You may want to explain the interview process of how you determine.
Okay. Well, this is going to be a little scary because, good point though. So as it turns out that epidemiology is a pretty blunt instrument. Okay. So basically, the way we determine exposures is to basically interview people, and so with I can't remember what I ate this morning, much less what I ate, an incubation period ago. So that's one issue.
Which is what, 2 weeks?
It can be up to 2 weeks. That's right. I think the average. See, now I should know this, but I think the average may be closer to 5. But so you're sort of we are always worried about recall bias of various sorts. But in this case, we also found some subclusters in restaurants with good receipts. So we had some confidence in that when someone said they ate a salad, we had a receipt, or a loyalty card that actually verified what they ate. So actually the precision. Funny thing about this. So the precision. So what's the 3 types of evidence that we're looking for? We're looking for the exposure evidence. We're looking for the microbiology, if it lines up with testing in the environment, in people, and we're also looking for the traceback. And the precision actually is coming out of the traceback and the microbiology, if you can get it. So that's why I think the traceability issue looms so large in this discussion, I'm going to guess, since I don't I'm not in your shoes.
Well, I understand, but you're going by like a DNA coding now, that's how you're trying to isolate it to a romaine, correct? Is the DNA coding for a, okay, can you hear me?
Yeah,
The
better.
DNA coding for romaine, is it different by varieties of romaine?
No. So it just shows you how we're all coming from a different perspective. We're coming from the perspective of trying to make sure that the cases we're interviewing are all part of the same event. So it's a signal to noise type issue. And that's, no, the quick answer to you is I don't know that that's at all the case. Maybe we'll figure it out, when we do enough testing in Romaine. But so the reason the signal is fuzzy, is so blunt to say Romaine is because that's the information we're getting and can verify. I don't know if I answered your question, but.
It's the sickness is the same, right?
Yeah.
The sickness of the people was the same, and they knew it went down to salad.
So
Whatever.
usually the consumer or the medical record doesn't have that level of granularity. Was it baby romaine? Was it chopped? Was it whole leaf?
But you're finding the DNA fingerprint of the pathogen, not the product. So when he talked about, that they've got the common, they've seen, 15 illnesses all had the same DNA fingerprint, that's the pathogen. It's not, they're not testing because they don't have the product. They just have, remains in you, and when you go to sick or go to the doctor and get tested, is the pathogen.
And that they all ate salad, but then it didn't break down to if the person ate a baby, did they eat a mixed salad or whatever?
Yeah, and Dr. Leanne, correct me if I'm wrong, I mean, part of the challenge with epidemiology, and like you said about the specificity, is when you ask a consumer what we ate, I ate salad. It goes back to 2008. What did you eat? I ate salsa. So everybody said, oh, it must be tomatoes. And we all know in 2008 it wasn't tomatoes, it was serrano peppers. So I think part of that is also helping to teach CDC with epidemiology, how to differentiate between some of the ingredients.
Go ahead.
We must deal with food service. Restaurants tend to destroy all the packaging we send to them. Retail, at least part of it, you'll have a band that's got some sort of barcode on it, or something that's great for a grocery store, but us, you go into a restaurant, they're ripping everything out, putting Mexican, all sorts of stuff. How do we get the restaurants, we're gonna actually start saving barcodes or boxes and stuff? I mean, how does that work?
Good question. Basically, they're going to ask you, can you tell me what the GTN lot number of the product was you put into my restaurant? And that's good enough for the investigation, because what they're looking for, if they can figure out that 10 people got sick from eating in 8 different restaurants, and those 8 restaurants provide from their distributors the GTN and lot numbers of all the, assume it's Romaine again, Romaine that went into those 8 restaurants, what they're looking for is a commonality, going, oh, all of them had Ed's Lettuce Company and, with these 3 different lot numbers. Let's go visit Ed's Lettuce Company, do testing at his facility, and figure out, is that the source of the pathogen? So they're not going to, some restaurants, like Yum Brands and others, scan at the back door of the store for internal efficiency reasons, and that works great. They can have those records. Most of them are going to be asking you guys to provide it, and that's good enough. They don't need to have proof in the restaurant. They need to be able to provide the information electronically, so FDA can put it all together and find where we have common numbers. At retail stores, by the time a consumer eats it and gets sick, that packaging's long gone. Even if it's a bagged salad, it's gone. By the time they get sick, it doesn't last that long. It's history. The PLU stickers or whatever they've got, they're gone. So it doesn't help anymore at retail. The only thing that retail can do is look at the cash register receipts and to see, okay, what, I said I bought romaine from Kroger last week. Good. Pull up my loyalty card and they can see my receipt and they can see what brand of lettuce. Unfortunately, We use PLU codes, which doesn't give brand specific, and we use these things called generic UPCs, which are all the UPCs that begin with 03383. They're generic. They don't tell you the brand. So one of the recommendations we've got coming out of Leafy Green, phase 3, is let's get off this generic identification at retail and let's go to company specific. At least we can tie the information about the cases coming into the store versus what's sold out of the store, and not a direct link with lot number, but at least it'll give you a direction to move the investigation.
Great. Angela?
Can you hear me?
Yeah.
We've been talking a lot about communication, which I think is great, and I think that was, distributors were in a tough place with respect to dealing with the market withdrawal, and so I think obviously there's a lot of good ideas that come out of here and how we improve that communication. But from my perspective, I don't know if I'm speaking on behalf of a lot of the other distributors in the room, but at the end of the day, what I'm really concerned about is mitigating the risk to my business. And I'm concerned about public safety. Don't get me wrong there, but at the end of the day, I want to know that what I'm, my takeaway from from all of this is that I'm doing a better job protecting my business. And so as distributors, we can have, WMS, we can take all these precautions, we can have insurance, we can do all these things to try to mitigate that loss, but we're still, we're getting this product from growers. And so that, to me, that's the missing piece of this discussion, which is what is happening at the grower level to help protect the distributors. Because in my mind, we shouldn't really be absorbing this risk because it's not really our risk at the end of the day. It's really driven by what's happening at the field level. And so we can have great communication, we can have insurance, we can have WMS, and all of these pieces, but we really are in the same place if we don't understand what's going on at the grower level and what's being done at the grower level to try to prevent this in the future and to help, so the growers are absorbing some of this loss because they're in the best position to control the risk. So I just don't know if anyone on the panel could speak to that or what, but.
Yeah, absolutely. I think, we agree. It's a full supply chain issue. It should not just be a distributor issue or a food service or a retail issue. And I think if you talk to our growers and our fresh cut processors, they definitely feel it. And I think this goes back to some of the things we talked about that the task force is working on in addition to traceability is root cause, right? We talked about how if you throw product away but you don't understand how the product was contaminated in the first place, that doesn't help anybody. So really helping to figure out the water issues and the root cause issues. And Ed just mentioned, United Fresh and PMA have been working really closely together on listeria management. So how do you set place in your packing house, in the field, in your processing facility to ensure that you're not creating an environment where product can be contaminated in the first place? So I think, I know the grower shippers and fresh cut processors have shared the same concerns and are working on it. What I think is going to be helpful is to bring everybody together so you can share that knowledge, right? Because if you're not in a room and you're not hearing what grower shippers and fresh cut processors are doing to try and mitigate risk on their end, I think that's where we need to continue to bring everybody together to have these conversations, which is what the goal of the task force is.
Unfortunately, in our industry, there's no kill step. So there's nowhere, unlike processed foods where you can boil it and pasteurize it, and if there is a pathogen, you're able to clean it up. Ours, especially leafy greens, they get picked in the field, put in a case, cooled and shipped. And it all goes back to good agriculture practices, make sure you're doing things right. I don't believe any of the recalls we've seen in the last dozen years, the farmers intentionally been negligent and said, I don't care if people get sick, I'm going to do this anyway. They think they're doing the right thing. Not all of them are doing the right thing, or they could have done other things, or they didn't see the risk. Or in case of Jensen Farms with the cantaloupes, they were audited and they passed their audit. The auditor failed to see the risk of parking that truck that hauled culls off to a cattle feedlot and parking it beside the packing shed. They didn't see that risk, and that's ultimately what killed 30-odd people. So we're, as associations, we're constantly trying to educate and you know, through the Center for Produce Safety, which was created to figure out what these causes are, and every time they figure out something, they share it. You know, a lot of work's been done on water and water management, and we're learning as an industry more and more, and we're sharing that knowledge, and people are implementing the practices. We're working with FDA on their regulation on water, making sure they get it right. And I know Jennifer and from United and Dr. Whitaker and Trevor Sussel from PMA are spending a lot of time with them, making sure that they get those regulations right, to make sure that, one, they're workable, and two, they're effective and going to stop product from getting contaminated in the first place. It's tough. It's if it was easy, we'd have figured this out a long time ago.
To kind of piggyback on that idea, and it's a great idea, we're only as strong as our weakest link from the grower, shipper, processor community. So to the idea of the pre-communication and a pre-announcement, what does, and I'm an idea guy, I don't know the logistics of here, but what does the turnaround look like of a communication that goes out to the grower, shippers, and processors that say, you need to test your water, you need to test the facility, we've identified this E. coli strand, and if you want to be all cleared on your product, we need a response in the next couple days to clear your facility and the supply chain so that we can eliminate you as a potential source for the contamination instead of trying to identify it, or they'll just be grouped in with the market withdrawal. You don't have to respond, but I mean, it's just an idea.
I'm not a scientist, so I can't answer that.
I mean, we have the science to identify the E. coli. I mean, I don't need an answer, but just let's continue the conversation. I'm pretty sure Taylor and Church and all the big suppliers would get those results pretty quickly to clear themselves if they had a couple days before an announcement went out to the entire country.
Well, those companies are testing regularly just as due course of business. That's how, and that's how most of them do it.
And so with that testing, in that time frame in the pre-announcement, can we have an announcement that says market withdrawal for Romaine except for these 5 companies that we have tested and authorized that they have no connection to this E. coli link?
One of the problems with Romaine, because it was, you know, non-processed Romaine, is you can test this, you know, if this was a field of Romaine, you can test in 15 different places, and good chance is you're not going to find that needle in the haystack, and you're going to miss it. And so you can't, you know, pre-harvest testing, you only get lucky if you actually pick up that head that has a pathogen. There's a good chance that this whole section could be contaminated, and you didn't pick anything from there. So unless you test every head, it's not going to be effective. And if you test every head, they'll probably be rotten by the time the test results come back, because these are not instant tests. They have to go to a laboratory, and you can probably talk to that. But it's not a, you know, dip it, oh, and the red light goes on and it's bad.
I think more to your point, how I took it more was what are the grower shippers actually doing, and providing you Church is doing this, and Greengate's doing this, and Diorigo's doing this. And I've actually collected a lot of these materials and tried to share them. Maybe I just missed whoever, and please reach out to me. I try to put it out at the beginning of each growing season, mid-season. This is post-Yuma, pre-Salinas. This is what we're seeing. These are the responses to these questions from these grower shippers. Really to help you make a better decision. You know, if that you're really speaking to how do I protect myself, it's really your supply chain, your suppliers, your vetting of those suppliers, and then really to the points made here is, do you know the lots coming in, and are you matching these lots going out?
So since you made,
Can I follow up on that? Okay, one of the, I guess, in terms of lot data, and I may have misinterpreted the FDA's report, I'm not sure, so don't hold me to that. But my takeaway from reading the FDA's final report that came out in connection with the April Romaine outbreak was that lot level traceability to the grower level is functionally impossible because multiple fields were being put into one big pot, so to speak, at the processing level, so it otherwise can't be traced back anyway. So part of my question is that are the growers doing and the processors doing something different in response to that, so that even if I provide them with lot data, you know, I provide the FDA and the CD, everyone with lot data, and so what? If you can't trace it back to actually have a recall to prevent the loss, what are we talking? I mean, you know, we're all talking about much ado about nothing, in my opinion. So are the processors truly implementing something where they are not just, I'm using the word dump, but dumping multiple fields into a processing batch and then moving on their merry way?
They have made changes, and probably Miriam can speak to specifically that whole harvest date. For me, I asked better questions because it was very ambiguous to me. Because a harvest date for a case of lettuce and a harvest date that's going to go on those microgreens or whatever they are with the mixes, and then you have a processed item. So all of that, with each one of these grower shipper processors, they actually have interpreted harvest date to be something different. So yeah, but as long as the definition was accepted and it wasn't regulated, it's been accepted. I know that both United and PMA are working with the grower shippers to tighten up that ambiguity that I see, at least, in quote-unquote harvest date and the meaning of it. And are we only going to do romaine? And then, well, if it's just romaine, what about iceberg? What about greenleaf? You know, the list goes on. So we are asking those questions. At least I have been asking those questions on behalf of PA. That helps.
I just wanted to know if someone was asked. I was just curious what the status was, so.
Yeah. And going back to Barb's point about what she said, is just as you are making the decisions of choosing a supplier where you feel you're getting the necessary information, these fresh cut processors and these growers are making decisions to say, hey, if you, person behind me in the supply chain, can't tell me the information I need, I'm going to make a decision not to do business with you. And so I think we're starting to see that, and they're starting to take it seriously. And you know, a lot of our folks are working to train their smaller growers that didn't feel they had the capacity to do the traceability, and they're investing the resources in their growers to make sure that they are, because they know otherwise it's going to affect the entire supply chain. So I do see that commitment from the grower shippers and fresh cut processors we work with the caveat that companies that tend to be part of alliances like this, tend to be part of associations like this, are forward thinking. So I think the challenge is going to be for companies that have kind of wanted to be on their own and not want to be part of associations to also get them to be part of this. Because as Tom, you said, it only really takes one company that's not doing the right thing, whether intentionally or unintentionally. And I think in most cases it is unintentionally. But the more we can do as an industry to educate all of our supply chain partners on why it's important to make sure we're doing things to the highest standard, the better.
Perfect. I want to,
I just want to ask this question. So, going into this recall, one of the big frustrations that I saw.
not a recall.
The
Mark withdrawal.
advisory that we went into. There's millions and millions of meals served with romaine lettuce. At what point does the CDC and the FDA decide that 34 is enough? I mean, you talk about risk and percentages. That's got to be like 0.0001% of people reporting the sickness. I mean, on a daily basis, people are probably getting foodborne illnesses on a regular basis. At what point do you say that's it? And I know Thanksgiving. So I didn't really get the answer. Was Thanksgiving a component of your advisory? Because on Wednesday or Tuesday that this came out, we know that the CDC and the FDA was kind of closed on Wednesday, Friday, Saturday, and Sunday. So I don't mean negative. I mean, when you think it's unsafe, it's unsafe. But what's the barrier of percentage of illness before you?
So the question is, what's the threshold for pulling the switch on a food safety element? And I probably can't answer that question about this event. I think in the end it comes down to do the investigators feel they have enough evidence? And it's usually at least 2 out of the 3 of exposure information, trace back source information, and that's independent of messaging, and microbiologic information. So to what extent did the impending holiday play into this? I heard one person say that because everything was going to be shut down, that increased her sense of urgency. I don't know if that's speaking for the whole team or just this one person, but I get it that sometimes these investigations, the switch suddenly gets thrown and people don't have any warning, and sometimes it comes on very fast, and it may be a mystery to the folks outside. What's the right number? We probably need to talk more afterwards about that.
All right.
But there is criteria, it has to be a multi-state, and are there any, if you have 3 different people from 3 different states with the same E. coli fingerprint, are you going to do a recall, or does it have to be 10, 20, 30?
So I'm like, I can't answer that, but yeah, so other things that go into this equation is, the size, the perceived size of the event, and coming off of Yuma. Again, I'm trying to read these minds. The concern was that this could be the beginning of a big thing. It turns out, if you look at the Ever curve, it wasn't. The other is seriousness. E. coli 0157, like 46% or so of the cases were hospitalized. So this is a bad infection. 2 got HUS, and luckily there were no deaths. But HUS, of course, can be a lethal event, long term. So I think the threshold, qualitatively, the threshold for E. coli 0157 for a product that doesn't have a kill step is probably lower than for raw poultry that's going to be, put in your oven and things like that. So I'm sorry I can't give you a straight answer, but there's probably not a good answer for that for you.
Perfect. Good way to end. I want to thank all of our panel members and thank you for this great discussion today.